Question 1. A 65-year-old male is admitted to the hospital with acute exacerbation of chronic obstructive pulmonary disease, COPD. The physician also notes he has a history of hypertension and type 2 diabetes mellitus controlled by oral medication. What is the correct sequence of diagnosis codes for this inpatient encounter? A. I10, E11.9, J44.1. B. J44.1, I10, E11.9. C. J44.1, E11.9, I10. D. E11.9, I10, J44.1. Answer: B. J44.1, I10, E11.9. This question tests your knowledge of sequencing diagnoses in an inpatient setting, focusing on the principal diagnosis. The key phrase acute exacerbation of chronic obstructive pulmonary disease indicates the condition responsible for the patient's admission. In inpatient coding, the principal diagnosis is the condition chiefly responsible for the patient's admission to the hospital, which in this case is the acute exacerbation of COPD, J44.1. Other documented conditions like hypertension, I10, and controlled type 2 diabetes, E11.9, are coded as secondary diagnoses because they coexist and are treated or affect patient care, but they were not the primary reason for the inpatient stay. Remember to always identify the main reason for the patient's visit or admission first in inpatient coding. Question 2. A patient presents for removal of a benign lesion on the arm measuring 1.5 centimeters. The physician performs an excision including margins, and the pathology report confirms the lesion is benign. What CPT code series would you typically use for reporting the excision of this lesion? A. 10,000 to 10,022. B. 11000, 11012. C. 11400, 11446. D. 11600, 11646. Answer: C. 11400, 11446. This question tests your understanding of CPT coding for lesion excision based on type and location. The critical information here is excision, benign lesion, and arm, part of the trunk/extremities. CPT codes 11400, 11446 are specifically designated for the excision of benign lesions based on location and size, including margins. The other options cover incision and drainage, 10,000 to 10,022, debridement 11000, 11012, and excision of malignant lesions 11600, 11646. Knowing the difference between coding benign versus malignant lesion excisions is crucial and determined by the pathology report, or the physician's clinical judgment if pathology is not yet back, though pathology is definitive when available. Always confirm if a lesion is benign or malignant as it directs you to the correct CPT code range. Question 3. A patient receives an injection of darbepoetin alpha, 30 micrograms, subcutaneously for anemia associated with chronic kidney disease. The drug was supplied by the physician's office. What HCPCS Level II code and units would be reported for the drug administered? A. J0881X3. B. J0881X30. C. J0882X3. D. J0882X30. Answer: A. J0881X3. This question tests your knowledge of HCPCS Level II coding for injectables and correct unit reporting. The specific drug is darbepoetin alpha, and the dose is 30 micrograms. HCPCS code J0881 is for darbepoetin alpha, 10 micrograms, non-ESRD, end-stage renal disease, use. To report a 30 micrograms dose using a code defined in 10 micrograms increments, you divide the dose given, 30 micrograms, by the unit increment, 10 micrograms, which equals 3 units. The other code, J0882, is for ESRD use, and options with 30 units incorrectly report the total dose as units instead of dividing by the defined unit increment. Pay close attention to the drug name, dosage, and the HCPCS code's unit definition, mg, mcg, etc., when reporting injectables. Question 4. A patient presents to the emergency department with chest pain. The physician performs a detailed history, detailed examination, and medical decision-making of moderate complexity. The physician documents reviewing past medical records and obtaining history from the patient and family. What is the correct E/M code for this visit? A. 99,283. B. 99,284. C. 99,285. D. 99,281. Answer, B. 99284. This question assesses your ability to select the correct emergency department, ED, E/M code based on the 1995/1997 documentation guidelines. Under these guidelines, ED codes, 99,281 to 99,285, are determined by meeting or exceeding the requirements for history, examination, and medical decision-making, MDM. A detailed history, detailed examination, and moderate MDM meet the requirements for Code 99284. Code 99283 requires a detailed history, detailed exam, and low MDM, while 99285 requires a comprehensive history, comprehensive exam, and high MDM. Remember to check which set of E/M guidelines, 1995/1997 or 2021, is applicable, especially for ED visits which often still use the older guidelines, and focus on meeting the documentation requirements for all three key components unless counseling/coordination of care dominates. Question 5. A patient undergoes a laparoscopic cholecystectomy with cholangiography. The operative report indicates the surgeon performed the laparoscopy, removed the gallbladder, and performed imaging of the bile ducts using contrast. What CPT codes should be reported? A. 47,562. B. 4605, 74300. C. 47,563. D. 47,600. Answer, C. 47563. This question tests your understanding of CPT coding for laparoscopic procedures involving the gallbladder and bile ducts. The procedure described is a laparoscopic removal of the gallbladder, cholecystectomy, with imaging of the bile ducts, cholangiography. CPT code 47563 specifically represents a laparoscopic cholecystectomy with cholangiography. Code 47562 is for a laparoscopic cholecystectomy without cholangiography. Codes 47600 and 47605 are for open cholecystectomy procedures. When a surgical approach, like laparoscopic, includes a bundled component, like cholangiography, look for a single code that encompasses both procedures rather than reporting them separately, unless CPT guidelines state otherwise. Question 6. What anatomical structure is primarily responsible for filtering waste products from the blood and producing urine? A. Liver. B. Lungs. C. Kidneys. D. Pancreas. Answer, C. Kidneys. This question tests your basic knowledge of human anatomy and physiology, specifically the function of key organs. The question asks which organ filters waste from blood and produces urine. The kidneys are the primary organs of the urinary system responsible for this vital function. The liver filters toxins, but its main product isn't urine. The lungs are involved in respiration, and the pancreas produces digestive enzymes and hormones like insulin. Understanding fundamental anatomy and the function of organ systems is essential for selecting correct diagnosis and procedure codes. Question 7. A patient is seen in the clinic for management of poorly controlled type 2 diabetes mellitus with diabetic nephropathy. The physician adjusts the patient's insulin dosage and orders follow-up lab tests. What ICD-10-CM codes would be appropriate for this encounter? A. E11.22. B. E11.9 and 18.6. C. E11.65. D. E11.22 and 18.6. Answer: A. E11.22. This question tests your knowledge of coding diabetes mellitus with complications in ICD-10-CM. The key elements are type 2 diabetes mellitus and diabetic nephropathy, which is a specific type of kidney complication caused by diabetes. ICD-10-CM includes combination codes that capture both the diabetes and its associated complication when a direct relationship is documented, as indicated by the term diabetic nephropathy. Code E11.22 specifically represents type 2 diabetes mellitus with diabetic nephropathy. You would not code the diabetes and kidney disease separately unless there wasn't a clear causal relationship documented, or if there wasn't a combination code available. Using the combination code E11.22 provides the most specific and accurate representation of the patient's condition. Question 8. Which of the following services is typically reported using HCPCS Level II codes rather than CPT codes? A. Office visit with a primary care physician. B. Appendectomy performed in a hospital. C. Durable medical equipment, DME, like a walker. D. Administration of a vaccine. Answer: C. Durable medical equipment, DME, like a walker. This question tests your understanding of the difference between CPT and HCPCS Level II codes. CPT codes are used to report medical, surgical, and diagnostic procedures and services performed by physicians and other healthcare professionals. HCPCS Level II codes are used to report supplies, durable medical equipment, drugs, and other non-physician services not covered by CPT. An office visit, appendectomy, and vaccine administration are procedures/services typically reported with CPT codes. Durable medical equipment, such as a walker, is reported using HCPCS Level II codes. Remember that HCPCS Level II is often used for products, supplies, and certain services not found in the CPT book. Question 9. The modifier -25 is used to indicate A. Increased procedural service. B. Significant, separately identifiable E/M service by the same physician on the same day of a procedure. C. Bilateral procedure. D. Professional component. Answer: B. Significant, separately identifiable E/M service by the same physician on the same day of a procedure. This question tests your knowledge of common CPT modifiers. Modifier -25 is a frequently used modifier that signifies that a physician performed a distinct, separately identifiable evaluation and management (E/M) service on the same date that a procedure or other service was performed. This allows for billing of both the E/M visit and the procedure when the E/M service was significant and went beyond the typical pre- or post-procedure care inherent in the procedure itself. Modifier -22 indicates increased procedural service, -50 indicates bilateral procedure, and -26 indicates the professional component of a global service. Properly using modifier -25 is essential for accurate billing when an E/M service warrants separate reporting on the same day as a procedure. Question 10. A physician performs an E/M service for a new patient in the office. The physician documents a comprehensive history, comprehensive examination, and high-complexity medical decision-making. According to the 1995/1997 E/M guidelines, what is the correct code? A. 99203. B. 99204. C. 99205. D. 99201. Answer: C. 99205. This question tests your application of the 1995/1997 E/M guidelines for new patient office visits. For new patients, 99,202 to 99,205, under these guidelines, you must meet or exceed the requirements for all three key components: history, examination, and medical decision-making, MDM. A comprehensive history, comprehensive examination, and high-complexity MDM meet the highest level requirements for a new patient office visit. Code 99205 is the only new patient office visit code that requires comprehensive levels for all three key components. Make sure to identify whether the patient is new or established and which set of E/M guidelines apply to determine the correct code based on the documented level of history, exam, and MDM. Question 11. A patient is diagnosed with malignant melanoma of the skin of the back, size 2.0 centimeters. Following the pathology report, the surgeon performs a wide excision of the melanoma with 1 centimeter margins. What ICD-10 CM code should be reported for the diagnosis? A. C43.5. B. D03.5. C. C43.5, Z85.820. D. C44.509. Answer: A. C43.5. This question tests your ability to code malignant neoplasm of the skin in ICD-10 CM. The key information is malignant melanoma, skin, and back. Malignant melanoma codes are found in category C43, and C43.5 specifically identifies malignant melanoma of the trunk, which includes the back. Code D03.5 is for melanoma in situ, which is a pre-malignant condition, not malignant melanoma. Z85.820 is a personal history code for malignant melanoma and would not be the primary diagnosis for the active melanoma. C44.509 is for unspecified malignant neoplasm of skin of trunk, which is less specific than malignant melanoma. When coding neoplasms, always confirm if it is malignant, benign, in situ, or of uncertain/unknown behavior, and use the most specific code available based on location and type. Question 12. Which of the following terms refers to the surgical removal of the appendix? A. Cholecystectomy. B. Appendectomy. C. Colectomy. D. Gastrectomy. Answer: B. Appendectomy. This question tests your understanding of basic surgical terminology. The term for the surgical removal of the appendix is appendectomy. Cholecystectomy is the removal of the gallbladder, colectomy is the removal of part or all of the colon, and gastrectomy is the removal of part or all of the stomach. Learning common surgical suffixes like ectomy, surgical removal, is fundamental to understanding procedure codes. Question 13. A patient presents for a screening colonoscopy. During the procedure, the physician identifies and removes a single polyp from the sigmoid colon. What CPT code should be reported? A. 45,378. B. 45,380. C. 45,385. D. For 5378, 45,385 to 59. Answer: C. For 5385. This question tests your understanding of coding colonoscopies when a polyp is removed during a screening procedure. When a polyp is found and removed during a screening colonoscopy, the screening code, for 5378, is converted to a therapeutic colonoscopy code that includes the polyp removal. CPT code 45385 is for a colonoscopy with removal of tumor, polyp, or other lesion by snare technique, which is the most common method. Code 45378 is only for a diagnostic or screening colonoscopy without lesion removal. Code 45380 is for a colonoscopy with biopsy. You only report the therapeutic code, 45385 in this case, and not the screening code, for 5378, when a polyp is removed during a screening colonoscopy. Question 14. A coder is reviewing documentation for a patient admitted with pneumonia. The physician notes pneumonia, likely bacterial. What is the correct approach for coding the type of pneumonia in ICD-10-CM? A. Code for bacterial pneumonia based on the likely bacterial statement. B. Code for unspecified pneumonia because the type is not definitively confirmed. C. Query the physician for clarification on the type of pneumonia. D. Code for viral pneumonia, as bacterial is only likely. Answer: C. Query the physician for clarification on the type of pneumonia. This question tests your understanding of the importance of physician queries for accurate coding. The term likely bacterial indicates the physician's clinical suspicion but not a definitive diagnosis of bacterial pneumonia. Coding guidelines require diagnostic statements to be clearly documented before coding a specific condition. In this scenario, the coder should query the physician to confirm if the pneumonia is definitively bacterial, unspecified, or due to another organism to ensure the most accurate ICD-10-CM code is assigned. Coding based on the term likely without confirmation could lead to inaccurate data. Question 15. What is the primary purpose of the National Correct Coding Initiative, NCCI, edits? A. To determine the medical necessity of services. B. To prevent improper payment for services that should not be reported together. C. To establish the fee schedule for CPT codes. D. To define the global period for surgical procedures. Answer: B. To prevent improper payment for services that should not be reported together. This question tests your knowledge of billing and compliance concepts, specifically the role of NCCI edits. The primary purpose of NCCI edits is to promote correct coding and prevent improper payment for services that are not typically performed together or where one service is integral to another. NCCI edits consist of procedure-to-procedure, PTP, edits and medically unlikely edits, MUEs. They do not determine medical necessity or set fee schedules, and while related to bundling, their main function is preventing inappropriate code combinations. Understanding NCCI edits is crucial for compliant billing and avoiding claim denials. Question 16. A patient is diagnosed with a pathological fracture of the femur due to metastatic bone cancer. What is the correct sequencing of ICD-10-CM codes? A. M84.55 C79.51. B. C79.51, M84.55 C. M80.85 D. M84.55 Answer: A. M84.55 C79.51. This question tests your ability to sequence codes for pathological fractures due to malignancy. When a pathological fracture is due to a neoplasm, the fracture code is typically sequenced first, followed by the code for the underlying neoplasm. Pathological fracture of the femur due to neoplasm is found in category M84.5, and C79.51 is for secondary malignant neoplasm of bone. Code M80.8 is for osteoporosis with pathological fracture, which is not the cause here. Therefore, the pathological fracture code, M84.55 is the primary diagnosis as it's the condition being treated, and the metastatic bone cancer, see 79.51, is a secondary diagnosis. Always remember to code the condition being treated as the primary diagnosis unless specific coding guidelines state otherwise, especially in the case of pathological fractures due to underlying disease. Question 17. Which of the following CPT codes represents a comprehensive metabolic panel? A. 80,047. B. 80,053. C. 80,061. D. 80,069. Answer: A. 80047. This question tests your knowledge of CPT coding for laboratory panels. CPT code 80047 represents a comprehensive metabolic panel, which includes a specific group of tests. Code 80053 is a comprehensive metabolic panel with total calcium. Code 80061 is a lipid panel. Code 80069 is a renal function panel. Laboratory panel codes are found in the 80,000 series of the CPT manual and represent a predefined set of tests performed together. You do not code each individual test within the panel separately. It's important to know the specific tests included in each panel code to ensure accurate reporting. Question 18. A physician performs a removal of a foreign body from the cornea using a slit lamp. What CPT code series would be appropriate? A. 65,205 to 65,222. B. 65,235 to 65,265. C. 67,101 to 67,113. D. 67,208 to 67,228. Answer: A. 65,205 to 65,222. This question tests your knowledge of CPT coding for foreign body removal from the eye. The key elements are removal of foreign body and cornea. CPT codes 65,205 to 65,222 are specifically used for removal of foreign bodies from the external eye, including the cornea, conjunctiva, and anterior chamber, based on the location and method of removal, e.g., with or without slit lamp. Codes in the 65,235 to 65,265 range are for removal of foreign bodies from the posterior segment. The 67,000 series codes relate to the vitreous and retina, while the 67,208 to 67,228 codes are for treatment of retinal lesions. Always identify the specific anatomical location of the foreign body to select the correct CPT code range. Question 19. A patient is prescribed a medication that needs to be administered intravenously in the clinic. The medication is supplied as a single-dose vial. What is the correct method for reporting the drug using HCPCS Level II? A. Report the J code for the drug and bill for the full amount in the vial, even if only part was administered. B. Report the J code for the drug and bill only for the amount administered, discarding the remaining portion according to protocol. C. Report the J code for the drug and bill for the amount administered, using modifier -52 for reduced services if part was discarded. D. Do not report the discarded portion of the drug, only bill for the administered dose. Answer: B. Report the J code for the drug and bill only for the amount administered, discarding the remaining portion according to protocol. This question tests your understanding of reporting single-dose vials and discarded drug portions using HCPCS Level II. For single-dose vials, Medicare and many other payers require reporting the amount of drug administered to the patient, plus any amount discarded. You report the discarded amount using the same J code with the JW modifier, if applicable, depending on payer policy, to indicate the amount discarded. You do not bill for the full vial if part was discarded without reporting the discarded amount separately with JW if required. Billing only the administered amount and discarding the rest according to protocol is the correct clinical and billing practice. Reporting the discarded portion with JW allows for potential reimbursement for that wasted amount. Question 20. A physician provides critical care services to a 45-year-old patient who is in respiratory failure in the intensive care unit. The physician spends 75 minutes providing these services on a single calendar date. What CPT code should be reported? A. 99,291. B. 99,292x2. C. 99291, 99292. D. 99291, 99292x4. Answer: C. 99291, 99292. This question tests your knowledge of CPT coding for critical care services based on time. Critical care services are reported using codes 99291 for the first 30 to 74 minutes and 99292 for each additional 30 minutes beyond the first 74 minutes. For a total time of 75 minutes, you report the initial code 99291, covering the first 74 minutes. The remaining 1 minute does not meet the threshold for the additional 30-minute increment required for code 99292. You report 99291 for time up to 74 minutes, and add on code 99292 for each full 30-minute block beyond the initial 74, but for 75 minutes total, only the initial code is met. Therefore, 99291 is reported alone for 75 minutes of critical care time. Correction based on typical CPT guidelines, 99,291 covers 30 to 74 minutes. Additional time is reported with 99,292 for each additional 30 minutes. 75 minutes is within the 30 to 74 minute range for 99291. Let's reevaluate based on standard CPT time rules for these codes. CPT guidelines for 99291 stated is for the first 30 to 74 minutes. 99292 is for each additional 30 minutes. For 75 minutes, the first 74 minutes are covered by 99,291. There is one additional minute beyond 74. Since 99292 requires at least 30 additional minutes, you would only report 99,291 for 75 minutes. Let's reread the question and options carefully. Okay, standard CPT critical care time coding is 99,291 for 30 to 74 minutes, 99291 plus 99,292 for 75 to 104 minutes, 99291 plus 99292x2 for 105 to 134 minutes, etc. So, 75 minutes falls into the range reported by 99,291 and 1 unit of 99,292. My initial interpretation of the ranges was slightly off. The correct coding for 75 minutes is indeed 99291 and 99292. Remember to check the specific time ranges defined in the CPT manual for time-based codes like critical care. Question 21. The term ipsilateral means A. On the opposite side of the body. B. On the same side of the body. C. Near the midline of the body. D. Away from the midline of the body. Answer: B. On the same side of the body. This question tests your understanding of basic medical terminology related to location. The term ipsilateral means on the same side of the body. Contralateral means on the opposite side. Medial means near the midline, and lateral means away from the midline. Understanding these directional terms is essential for accurately interpreting physician documentation and selecting the correct codes, especially for procedures involving paired organs or limbs. Question 22. A patient is diagnosed with acute appendicitis with generalized peritonitis. What is the correct ICD-10-CM code? A. K35.2. B. K35.30. C. K35.32. D. K35.80. Answer: C. K35.32. This question tests your ability to code acute appendicitis with complications in ICD-10-CM. The key information is acute appendicitis and generalized peritonitis. ICD-10-CM codes for acute appendicitis with peritonitis are found in category K35. K35.32 specifically represents acute appendicitis with generalized peritonitis. K35.2 is for acute appendicitis with localized peritonitis. K35.30 is for acute appendicitis with localized peritonitis and gangrene, and K35.80 is for other and unspecified acute appendicitis. You must select the code that most accurately reflects the documented severity and extent of the peritonitis. Question 23. Which section of the CPT manual would you find codes for surgical procedures performed on the musculoskeletal system? A. Surgery digestive system. B. Surgery urinary system. C. Surgery musculoskeletal system. D. Surgery nervous system. Answer: C. Surgery musculoskeletal system. This question tests your familiarity with the organization of the CPT manual. The CPT manual is divided into sections based on body system or type of service. Surgical procedures performed on bones, muscles, joints, and tendons are found in the surgery section under the musculoskeletal system heading. The other options refer to different body systems covered in separate subsections within the surgery section. Navigating the CPT manual efficiently requires understanding its organizational structure and where to locate codes for specific procedures. Question 24. A patient is seen in the clinic for a follow-up visit after hospitalization for a myocardial infarction, MI, that occurred 2 months ago. The patient is stable. What is the correct ICD-10-CM code for the follow-up visit? A. I21.9. B. I25.2. C. Z09. D. Z86.73. Answer: B. I25.2. This question tests your knowledge of coding sequelae of myocardial infarction. Since the MI occurred 2 months ago and the patient is in a follow-up period, you would code the sequela or history of the MI. Code I25.2 represents old myocardial infarction, indicating that the patient has had a previous MI and is not currently experiencing an acute event. I21.9 is for acute myocardial infarction. Z09 is for encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm, which is too general. Z86.73 is a personal history of myocardial infarction. The code for old MI, I25.2, is the most specific code to describe the patient's current status following a past MI. Question 25. What is the term for the process of assigning numerical and alphanumeric codes to healthcare diagnoses, procedures, services, and equipment? A. Medical billing. B. Health information management. C. Medical coding. D. Revenue cycle management. Answer: C. Medical coding. This question tests your understanding of the fundamental definition of medical coding. Medical coding is specifically the process of translating documentation from healthcare encounters into universally accepted numerical and alphanumeric codes. Medical billing uses these codes to submit claims for payment. Health information management is a broader field encompassing medical records and data, and revenue cycle management is the entire financial process from patient registration to payment collection. Medical coding is the essential step that allows healthcare services to be accurately reported for billing, data analysis, and research purposes.